Gail, thank you very much indeed. That was terrific. Really good to see you here. Let me start out just with a couple of questions, and then we'll open it up to the floor. But one of the things I wanted to suggest is we often talk about state, non-state, government, private sector, civil society, as if they are homogenous entities. And of course they're not. There's great heterogeneity in all of those. And as a government, within ministries and between ministries, getting cooperation and collaboration and getting coherence is not always that straightforward. So in terms of the SDGs playing out in Oslo and at home, how does that play out across ministries? There are some that are clearly, in the forefront and leading, and others that take, a little bit of pulling along. And how important, I think it's remarkable that Prime Minister Solberg is going to come to the high-level political forum for this first one. How important is that leadership in terms of getting that coherence and collective buy-in across ministries?
No, frankly speaking, we had a little bit of a strategy that we said that if we really are to be successful here, we need, from day number one, to mobilize the Prime Minister. She needs to feel that this is her responsibility, and if she delivers, it's her success. And by doing that, we also were able to mobilize the other ministries. The key ministry, of course, is the Ministry of Finance, and the Ministry of Finance is working on this. But in all, this is not public, is it, or is it? Yes. Well, I changed my line then. Anyway, to put it like this, Ministry of Finance are, of course, you don't find the revolutionaries in the bureaucracies in the Ministry of Finance. It's not their job. So you need to see some push. You need, there is a lot of, there will be a lot of, for all of us, there will be a lot of, different departments will fight about this and that. But as long as I think you have this, with the Prime Minister in the lead, and in all fairness, with a rather broad consensus in the Norwegian society for sort of the direction we're going to go. Of course, there are also serious disagreements. That's obvious. But with the Prime Minister in lead, I think we can be successful, yes.
Great, thanks, Geir. And then just sort of going back to your role on the financing for development, and one of the things we've been talking about, you've talked about it, others have talked about it, moving from billions to trillions. Macharia Kamau, the Kenyan ambassador, who was one of the two co-facilitators for the adoption of the SDGs, was part of the opening for the Global Compact leaders, and he was talking about this and talking about while it sounds a lot of money in terms of the global stock of resources, it isn't. And I look at your sovereign wealth fund as one of the, if not the largest, fund. In terms of its investments and the thinking around its investments going in a way that live up to the values of sustainability and live up to the value of social impact, do you see the SDGs changing investment portfolios, across Norway?
I think we've started seeing it, but the question is whether this really will be a global phenomenon or not. Because it's fine for us to do some changes, but what we really need to see is that this is really happening globally. It's interesting when you see that actually there are currently a lot of uncertainties when it comes to the European markets, questions being asked about the US market. And we know there is a great potential in Africa. There are many, many challenges. But what was very interesting during the process that I and George Talbot were leading last year was that we met with quite a few, from the investment sector, from the private sector, from business sector. And what we realized was that there was a lack of understanding, from the investors about the opportunities in different places, but also a lack of understanding from, let's say, whatever country, for instance, in Africa, about what needed to happen to create an interest from certain investors in that country. So we worked a lot on trying to establish these contacts, just to open up the eyes so that people can see the different opportunities. Let's take infrastructure as one example. There are, tens of different initiatives within the infrastructure sector globally. but there is very little comparing of notes between these different initiatives. You know, we have the World Bank, you have the G20, you have G7, you have the new Chinese initiative, you have the different development banks. So what we wanted to achieve last year was that at least once a year, you should try to get a gathering of investors, development banks, and governments to come together, sit down, and see where are the bottlenecks, where are the opportunities, and what could we do to try to speed up the investments we need. On infrastructure, it's an extremely important area because we will not be successful if we're not successful within the infrastructure sector. Within the World Bank, they don't like it when I say this, but let me put it like this. It's claimed that it would usually take 17 years for an infrastructure project from the day it is sort of initiated until the day you actually see it being implemented, 17 years. And that is because there are many good reasons, many questions you need to ask before you do, infrastructure projects. What's the impact on the minorities? What are the environmental impacts and so on? But we know that if it takes 17 years for investments in infrastructure to take place, there is no way we're going to be able to implement the 2030 agenda. So we need to speed things out, and we need to make some really tough decisions, and we need to make them within the next 5 years. And if we don't do that, there is no way this agenda is going to be implemented.
Thanks, Gail. Let me open it up some questions from the floor. I have Kate.
Good morning. Thank you for joining us, Ambassador, and for your leadership on this agenda to date and in the future. I wanted to ask, you mentioned in the health space Norway's commitment not only to the Global Financing Facility, but also to the Coalition for Epidemic Preparedness and Innovation. And I wonder if you can first, if you feel like you can share a little bit more with this group about it, because I think it's new to some people in this room, but more generally speak about this theme of how, maybe in the context of FFD negotiations or the actual meeting in Addis, this issue of how public finance can help address market failures in health or more broadly, and think about it in the context of epidemic preparedness, in the context of antimicrobial resistance and the high-level meeting that's coming up in September, or maybe from other sectors where you've seen some successful models that we should be thinking about in the health space.
Yeah, we had a big discussion about, how do we deal with this, and the question about market failure. And I think you're going to discuss sort of regulatory means later on here. So, but let me be very, very brief, because I think you will get back to it later on. But there are so very different approaches to this. In Norway, we believe that it's the responsibility of the government to put in place a clear regulatory framework, based on sort of a policy understanding, that we send a message to the business, the private sector, industries, for sort of what they can do, what's the framework within they are able to compete and to work out the profits. And if we want to see changes, then this is extremely important. Let me just, it's sort of indirectly relevant here, I believe. Let me take one example. We put very high import taxes on cars. So if I want to buy a car in Norway, I have to spend, a lot of money, very expensive. Nearly 50%, goes to the government, which is a good way. So, but obviously for us, private cars is a big part of the emissions that we are, producing. So the government decided some years back that if you buy an electric car, you don't pay anything to the government. So surprise, surprise, we as consumers, we reacted to this. So today in Norway, we have approximately 70,000 electric cars. In California, we are 5 million people. In California, they are 30 million people. They have 120,000 electric cars. In Sweden, they haven't done the same. There will be changes. There are hardly any electric cars. So, the government has a responsibility for how it will put things together. And the government can create a space for change and can show leadership. And this goes, I think, into many, many different areas. And of course, then there are trade-offs on how to do this. But one of the biggest disagreements we had, and we still have within the international community, is, of course, what kind of regulations are necessary to address market failures? Will this be understood by the business itself, by the investors themselves, or do they need government and us as consumers to come in and to tell them? I mean, we in Norway tend to be on the side, on the state, giving clear directions. Here in the US, obviously, it's the other way around. Hopefully we can, be able to meet. I believe, frankly speaking, my personal opinion is very strongly, without a stronger regulatory push, we're not going to be able to implement this agenda. There is no way we're going to see it, because time is running out. On the initiative that I mentioned, what we learned from Ebola was basically this, that if we are not prepared for this, we may not be as lucky next time. There's a lot of work still going into this, but when it will be presented in Davos, I think we have some more details that we can also share with you on this.
Great, thanks, Geir. I have Joe.
Yeah, I wanted to go back internally. We had a good bit of discussion yesterday about the relative, you mentioned Minister of Finance is the first one you mentioned as important in this change, and we had a discussion yesterday, obviously, in many countries the Minister of Health is relatively weak in the government structure, and you mentioned because you do have political leadership, this sort of intergovernmental, interagency collaboration is higher. I wonder if you could talk a little bit about the role of a Minister of Health, or the role of this, sort of shifting to health impact of various decisions being made, sort of like the car example you gave across agencies within Norway, and then similarly, how you think about exporting that framework to your international development assistance in terms of working with political leadership around choices they could make around infrastructure projects or other activities.
Well, one of the most difficult issues is, of course, how do you explain your own national experience without sort of being seen as being teaching? Because if you teach, if you sort of point fingers, you will not be effective. So, I think part of our strength is that we are so small that, 5 million people, everyone understands that, we cannot force anyone to act in a manner that they don't see in their own interest. But then I think there is one important thing I want to mention, that is that we know that institutional change takes time. There was a very important report from the World Bank in 2011, in the World Development Report on peace and security. And it basically said that, institutional change would take a generation. So why is this relevant for the SDG agenda? It is relevant because we need so dramatic changes to take place within the next 15 years. And so you need to see that this is driven nationally. It needs to be nationally owned processes, and then you need to base it on lessons learned, and we need more data. And in many countries, for instance, for the health ministry, there will be a lack of data. They don't really know. They don't have the information they need to be able to implement and to move forward. And here, that's why we believe that you need to mobilize, different thematic responses. So in vaccine, we go in together, we cooperate, because the different national health ministries will not be able to be successful. And I think it's a model that's been working very well. But health is sort of one of the areas that is very, I hope this doesn't come across wrong, but it's an area where it is relatively more easy to work because it's easier to measure your success. You can actually see that you have an impact. We know that with the work we've been doing in Gavi, we saved millions of lives. It's much easier to mobilize support for these kind of activities. In many other fields, it will be much more difficult to do it because it's much more difficult to measure and to see that you really make progress. And this, I think, will be the big, big challenge. let me just very briefly say, what we need in this agenda is, we need some good examples from what I call the North, but even more importantly, we need good examples from the South. We need leadership. One of the reasons why we were successful in fighting poverty was, of course, because of China. No doubt about it. Huh? But what we need today is sort of another development, or few other development states to come forward as examples on how it is possible to fight poverty and also to fight climate change at the same time. And here there will be some trade-offs. I have some good examples, but not all of us will like them.
Thanks, Geir. And just sort of pivoting to that sort of leadership elsewhere, Natalie, I don't know if you were going to talk a little bit about the public-private partnership in Kenya. I know the person who was going to come couldn't make it, but it would be a nice sort of moment just to have a very quick expose of that partnership. Thanks.
Okay, so for those who don't know me, I'm Natalie Africa. I'm Senior Director at the UN Foundation for Private Sector Engagement on Every Woman, Every Child. So we have tried to get the county executive member for health from Lamu County in Kenya out to this workshop to share a little bit about this very innovative public-private partnership for maternal health that we've catalyzed under the banner of Every Woman, Every Child in Kenya. He couldn't get his visa, so I'm going to share a little bit about what it's about, but I'm also going to turn it into a question afterwards because we'd like to do more of this under the SDGs. So, in Every Woman, Every Child over the last 5 years, we've catalyzed commitments from a huge number of companies, over 80, that have made often individual commitments, and they work often in partnership with governments, UN agencies, and civil society. But what we wanted to do last year is to create something that went beyond individual companies, and that was collective, as a contribution to the SDGs and the updated global strategy for women, children's, and adolescents' health. So the impetus actually came from a conversation I was having with the representative from Merck. I'm not sure if, yes, from Merck for Mothers, Naveen Rao. And we started talking about what, where, when, and who to pull in. We decided about Kenya. We decided to focus on Kenya because we wanted to know we'd work in a country that is business friendly, where a lot of the companies that we are working on are active and operational, and where there are needs. There was also the convergence of the global financing facility for Every Woman, Every Child, with Kenya being one of the front-runner countries, so we felt we could get a fertile environment there as well. We then started thinking about who to work with, and UNFPA has done some fantastic work there in terms of mapping the impact of maternal mortality. So we started conversations with them. And I'm mentioning this just to say how it came together, because that also shows the leadership and the kind of responses that you want to see when you're building a partnership like this. So Kenya, even though officially it hasn't been a country at war, it actually has one of the highest rates of maternal mortality in the world, higher than countries like South Sudan or Sierra Leone that have been at war. And this is because in the northeast of Kenya in particular, you have a situation where certain counties have been completely neglected over the last 50 years, and their infrastructure, when it just comes to health systems, education, roads, everything is completely poor. It's very poor. So what happened is that UNFPA mapped that in Kenya, there were 6 counties in the northeast that are responsible for 60% of maternal deaths, even though the population in these counties is only 10% of the national population, 10% but 60% of deaths. So they decided to focus on a very targeted strategy there. So when we came to speak to them about working with the private sector, we agreed to focus on this area and create a public-private partnership around maternal health in the 6 counties. So the companies that have come together with UNFPA, and I have to say what also enabled it is that there's been strong leadership in Kenya, especially from the First Lady, Madam Kenyatta, with her Beyond Zero campaign around reducing maternal and child deaths. And so there was leadership in Kenya on national level. You had a UN agency that had taken a very strong lead and understood the situation, what needed to be done. And then lastly, over the last few years since 2010, there's been a devolution of government in Kenya where counties are now responsible for health expenses, which wasn't the case before. So for the first time, these counties have money budgets coming from central government where they can make decisions about clinics, about road infrastructure, about services, about training health workers. So all that together meant that there was a lot of very enthusiastic leadership and responses to this. So the companies that we brought together are 2 local and 4 international, and there's the Kenya Healthcare Federation, which is a federation of private sector providers in Kenya, and that includes not just hospitals or clinics run by private operators, but also faith-based providers, NGOs, and so on. So Kenya Healthcare Federation, who are actually now hosting this initiative, Safaricom, the mobile phone company that does a lot of work around mHealth, Merck, GSK, Philips, and Huawei. The partnership is growing, so we will continue to reach out to other companies, but the whole point of it is to say, how can the companies work in these counties, bring their assets, core expertise to bear? So each of them are now defining their exact investment, how they can contribute. So Huawei, for example, has just announced an initiative in Lamu County around telemedicine using their expertise as a computer and technology firm. Philips, for example, will be rolling out using their expertise in both energy and health, community life centers in some of these counties. And each company is looking at what they're going to do. Merck is going to focus on sexual reproductive health for adolescents. So it's very promising, and this is the kind of initiative. Yesterday, one of the speakers spoke about collective impact that I think we want to see more of in the SDGs, and we're very proud to have catalyzed this as one example from the South. But the question that I have is, in the SDGs, I feel if there isn't a concerted effort from governments to put in place models to do more of that, we will miss the opportunity. I think in the MDGs, and I've been working with companies through the MDGs as well, there was a lot of missed opportunity because governments in the South, and I'm from the South, were not always as proactive as they could have been in saying, how can we tap into private sector expertise in that way, local, international, and so on. It was still often, we'll get it done as governments, and we'll try and meet those targets, and maybe there are people we can call on. And I think we need to find a way, and I'd love to find out from you, Ambassador Peterson, having managed the SDG process, how you think governments are going to do that in a very deliberate way so that we don't miss these opportunities again.
Can you hear me? Yes. I have no good answer to that. I think, but it's the key question. I do agree with you, and I think the example you mentioned was so important, and it proves, as you rightly said, that local leadership is possible. But then you also need to have, a system in place that can actually respond to that local leadership when it takes place. The challenge is, as you rightly said, also when that local leadership is not shown. And we really need to see that progress is being made. This is, I'm afraid we're going to struggle with it, but I hope that perhaps after the first round that we will have now at the high-level political forum, that these things will come up, because we have known all the way that this is going to be the key challenge for how to move forward. Is it fair to say that we have the system in place to respond to this as of yet? Absolutely not. So I can just say continue to press us on this. I think that's extremely important.
So, Ger, thank you so much. The high-level political forum runs from the 11th to the 20th, with the high-level segment between the 18th and 20th. The theme is ensuring no one is left behind. It includes a voluntary review of 22 countries, one of which is Norway, the only one bringing a head of government. And if that's not leading by example, I don't know what is. So we very much look forward to that. Major groups, including business and industry, are invited to the forum. So it's a great opportunity to try and ensure that we're hearing from countries, the opportunities and relationships with multiple stakeholders, including business. Goal 3 will be reviewed in the 2017 high-level political forum under the theme of eradicating poverty, promoting prosperity in a changing world. So you've got health and prosperity linked in that theme there. So with that, would you please join me in thanking Ger Peterson for joining us today. It's really helpful.
Pleasure being here. Continue the good work.
So why don't we take a 5-minute stretch in the room, if you refill your coffee cups, and we'll prepare for our panel.